Hi everybody, today I'm going to just go through a quick video on how to nebulize glutathione from a reduced glutathione powered capsule. I'll go through sort of all the equipment that you'll need first. This actually in the background is actually a baby bottle sort of sterilizer. Some of you might have used them when you were parents. This is actually a good way of sterilizing all your equipment or keeping them sort of quite clean. You don't have to be completely sterile, but I think it's a good idea to be as clean as we possibly can. So you might sterilize the little shot glass that you'll be making the solution in. So on that topic, you want a shot glass or a little glass with a sort of a small conical sort of bottom shape, and that will allow you to mix up the powder and make a solution out of it the most easily, or even like a espresso cup can be used as well. You'll need a little sort of spoon. Again, this is just a little coffee spoon. You'll need some saline, isotonic saline. So this is saline for irrigation, for rinsing out your eye. You can also get saline for injection as well. And this little container is 15 ml, and it did have a little top that I have already snapped off. And this will probably be enough for 2 or 3 solutions that you'll make. And again, so that was sterile. Once you've snapped off the top, of course it's not sterile then, but I think it'll be fine for 1 or 2 days use. This is a little nebulizing machine. This is a portable one. Unfortunately, this particular brand that we were able to get in before, they no longer supply this. You can get nebulizers just from your local chemist as well, which is what you're going to probably have to do. There's a tube. One end goes in this end, and the other end will go in what I'm about to show you. This is the receptacle that you'll put your solution in, and that opens up, and there's another little adapter there. And what you're going to be doing is pouring the liquid into that, and then you close it up again. Don't tip it upside down because it's actually not sort of liquid tight, so the liquid will probably pour out if you do that. There's a mouth nozzle that you can use, and that just sits on the top. Or you can use a mask as well. Again, that sits on the top, and you could put that on. And glutathione, we've just got a brand new product in. The problem can be that you'll get a reduced glutathione capsule or powder, and it'll have what they call excipient. It'll have extra additives when they're making it, when they're producing it to make the glutathione flow, so they can fill up the capsule. But some of these excipients, I actually wouldn't recommend inhaling all the time, frequently. One of the excipients that I found in some of the products is silica or silicon dioxide. And I'm not sure exactly how much will be in a capsule, but certainly there are things, you might have heard of Caesar stone, and cutting that is an occupational health hazard because the silica is actually quartz, silica dioxide, that's quartz, and you can get something called silicosis, so this inflammatory disease of the lung lining by inhaling, I suppose, larger amounts of it. So that's something that we have to be careful of. You'll actually be difficult to find a glutathione product in a capsule that doesn't have some sort of excipient. This particular product that we just got in, just sourced recently, is buffered. So glutathione tends to be in solution a bit acidic, and depending on the concentration that you make up, when you start to breathing in, you sort of hit the back of the throat and you sort of want to cough, and that will be a good indication that it's actually too concentrated and you'll need to dilute it a bit further. This, I think, because of the little buffering ingredient that they add, will allow you to have it actually in a much more concentrated solution. So let's go about making this glutathione solution to use. So as I said, everything's clean. If you're not using a baby bottle sterilizer, boiling water after you've used it once, wash it out with some mild soapy water and then give it a good rinse, and then rinse it out with boiling water and just keep it as clean as possible is probably a good thing to do. So I'm going to actually use this little glass because it's a nice shape, and I'm going to take the little capsule and I'm going to empty it into the glass. And it's a bit like making gravy, you know, the corn flour. If you add too much water to it to start with, it will clump together and you won't get it into solution. And this is a bit, I find the same with this. So I just start with a few drops just to start to moisten. And this is actually bubbling. This is the first time I've used this particular product. So that's the buffering ingredient in there, and it's actually frothing up. You can see that. And that's already dissolved. So the other products that we had used was much harder to get into solution, and in fact this one's specifically made for inhalation, for making up this solution, and it even says that you don't need a lot, like 1 to 3 mils, whereas the other product that we were using in the past, you definitely needed 5 or more mils to get rid of some of that acidic or a little bit of irritating nature of when you start inhaling it. It's not quite dissolved. You probably can't see that. It's a little bit milky at the moment. So normally I would make up a bit of a paste and then I would gradually add more of the saline to it. So I'm just going to add a couple mils more straight away and then just keep mixing that until it becomes sort of a clear solution. So that's a little bit better now. You probably won't be able to see it. It's got a tiny bit of milkiness to it, so I'm just going to keep stirring that. You probably want at least 3 or so mils with this particular product, just so you get a bit of a volume of liquid that you're going to nebulize. Yeah, that's nice and clear now. I don't know if you can sort of see that. That's quite clear. That wouldn't be more than, say, 3 or so mil. What I'm going to do is I'm going to try it at this concentration and see if I get that irritating sort of feel at the back of my throat that sort of want to make you cough. So I opened up that little receptacle and I'm going to pour the solution that I just made into that. I'm going to close it up. I'm going to attach the other end of the tubing to that. I'm going to put on the mouthpiece to start with. I'm going to turn it on, and what you'll actually see is that mist that gets created. So it's a matter of now breathing it in. So that was quite good. Slight sort of tangy sort of flavor on the tongue. And you could use a mask as well. So the mask will be a similar sort of thing. I won't actually put it on, but I'll turn it on so you get some of that mist coming out. I'm actually going to prefer the mouthpiece. And what you'll do is there's a little bit of liquid still in the bottom of that, so you'll keep on nebulizing it and breathing it in until that's completely finished. So I'm just going to do that a little bit longer. So you get the idea of that. And the reason why we're nebulizing the glutathione in this manner is this is really quite cost effective. This particular product was a little bit more expensive than some of the other ones that we've used in the past, but you imagine the surface lining of your lungs is just vast, and you're breathing in the glutathione. It gets absorbed directly into the lung tissue, the lung surface. The problem with taking oral capsules of glutathione, and this is probably why we don't use it very often orally, is it gets broken down in the digestive system, and then it gets rebuilt up in the blood, and then broken down again before it goes into the cell, and then recreated in the cell. So it's quite a inefficient sort of process, hence nebulizing it. The other way you could use, which sort of overcomes some of that digestive breakdown, is actually a liposomal product as well. Hence why you have a lot of liposomal glutathiones. And then probably the best way of getting a really high dose into the system is actually IV, but that's quite cost prohibitive, and you have to go somewhere to have that done. Hence, the nebulized glutathione is a really great way of cheaply getting really high doses into the body. So yeah, thank you for that. We'll probably put in the description some of the products that we've used. Saline for irrigation or injection, and you can usually get that even just directly from a chemist or a medical supplies company. The reduced glutathione powder, and as I said, you have to be careful of what products you pick for that. And we'd found it quite difficult to get a more pure product, or a product that had only an excipient that was what would have been quite neutral in the effect on tissue. Okay, thank you very much.